Why do nurses and nursing students acquire anxiety disorders? Hey, it's Case! Hi everyone, my name is Casey. Welcome to my channel, or welcome back to my channel. If you're new here, make sure you subscribe to my channel by hitting that subscribe button down below, and make sure you hit the bell notification so that you get notified whenever I upload a video. I do it with all my favorite channels, so it just makes everything so much more convenient. I always know when my faves got a new video up. But today, I'm trying to talk in kind of like a lower toned voice. I'm going to be talking about a kind of serious topic today, and that is nursing school and anxiety, or really just nursing and anxiety in general. The field of nursing and becoming an RN or an LPN and working in the hospital is such a high stress job. You literally have patients' lives on the line. It's really the nurse's responsibility to do everything that the doctor orders for the patient, to carry out the orders, and we are the ones that are supposed to see if things are right or wrong, notice if a patient's going south. All of those things, their lives are in our hands, and it's such a stressful job. In school, nursing school that is, plummets normal people to become crazy people. So I am no stranger to anxiety hitting at me full force when I started nursing school. I know so many of my peers that have had to go on anxiety medications or, just deal with panic attacks as a result of being a nursing student. And as I talk to nurses working in the hospital alongside of them and just talking about my issues in life and sharing stories with them, I am not alone by any means. There are so many nurses out there that are on prescribed medications for anxiety and depression, but mainly anxiety. With that being said, I'm just going to tell you a little bit about my own personal experiences. I started nursing school in pretty much August of 2015, and by October of 2015, I had to go on Xanax. Rather, I was having these massive panic attacks, uncontrollable. I could not sleep at night. I barely wanted to eat. I was just so mopey. I was depressed and really freaking out about life. I think that was the point in the semester where we really started to learn exactly what was at stake as a nurse, and it freaked me out. I started having just the worst impending doom feeling that I've ever had in my whole entire life. I was not sleeping at all. I will definitely leave my vlogs linked down below from that time period. I've vlogged my whole life the past 4 years, so I have those moments in my life documented, so you guys can go check those out if you want more details about the specifics of what I was going through. When anxiety hits, you really don't even realize where it's coming from. It just comes and overwhelms you like a wave of awfulness, and all you want to do is cry and get out of your own skin. It physically hurts to have a panic attack and experience anxiety. So I was experiencing this mostly at nighttime, right before bed. That's even in my personal history is about the time of day where anxiety would hit me. So I started having those bad, awful panic attacks really late at night, right before bed, where I couldn't sleep in the morning. I was just so worried and worked up about the upcoming days or the next days that I had in front of me. So I went to my doctor, and me and my doctor are very open and honest with each other, and I'm able to communicate a lot with him, kind of like a therapist almost, but he's my primary care doctor. And he suggested therapy and things like that, and I've actually struggled with anxiety in my past. Right before I started college, I kind of hit the same issues, but this time it was much more intensified as a nursing student. It was much more intensified. So we kind of talked about that, and I kind of was thinking it's, because my grandma passed away, I'm having all of this anxiety of missing her and separation anxiety. He really suggested that I go talk to somebody about it, but I'm so comfortable with my family and my friends that I let everything out to them. I talk to them every day. I let them know all my problems. I'm very open and honest with them, with my friends, with my family, and even with you guys, pretty much everything, every detail of my life. So I didn't feel that really talking to some stranger was going to help me with the anxiety. So in the past, my doctor has recommended medication for me, and this time I was like finally willing to accept something. So since my panic attacks weren't quite chronic at this point, they were pretty acute situations where this was happening. It just so happened that I went and had them for like a week straight of like acute panic attacks. My doctor then prescribed me Xanax or alprazolam, Xanax PRN as needed whenever I had a panic attack. So I know that alprazolam is a benzodiazepine, and it is a very controlled substance, and when you're put on a medication like that, you're on like this state registry and your name is on there as being diagnosed with whatever disorder you have, and you're on like this list. So it's a very controlled substance. It's not something that you should, take lightly when you're on it. So I definitely took it with caution and care. I only took it when I was experiencing a panic attack or right before it was about to happen. And even after I got it, I probably took about 10 pills out of the 30 that I had supplied to me. Just knowing that I had it just in case something terrible, like a terrible feeling came upon me, just knowing I had it made my anxiety lower. It's kind of crazy how that like mind over matter thing works with anxiety. If you can achieve that and have anything in your life, it doesn't have to be medication, something that just is there as a safety net that is there in case you need it when you have anxiety, is just a wonderful thing to have. I had that and my anxiety started to subside. I don't know if it's this time of year or what, like the fall time. That's kind of why I wanted to make this video right now. October is always my month where I am progressed further into some kind of anxiety disorder, but I'm hoping that it won't get bad this month. I feel pretty in control at the moment. So that was in 2015, and then in 2016, last fall, when I was in my 3rd semester in nursing school, in October again, it came, and I started experiencing anxiety during the day. For like the first time in my life, I would get like flushed, I would start having palpitations, really dry mouth, just like all of the signs and symptoms of a panic attack during the day. And it would come randomly throughout the day. I'd just feel my heart racing. I would feel so flushed and so anxious and like just like crying for no reason. So I went to my doctor again, and this is where I was like, I know that Xanax, I have it in case I need it, but I need something that I can take every day to kind of mellow me out and keep me at a steady state and not freak out during the day. It was so funny because at the time I was actually in my psych course in nursing school. So I don't know if talking about anxiety and all of these mental disorders kind of triggered my anxiety again. That could have been it. I don't know. But talking about anxiety made me have anxiety, and that is like another problem with people that have anxiety, is like talking about it. You might find that you have that in common with someone, but it makes you anxious talking about it. Like right now, I feel flushed, I feel hot, my mouth is dry, so I'm experiencing a little anxiety as I talk to you all. With that being said, having these panic attacks in the middle of the day was just no way to live. So I went again to my doctor, and this time he prescribed me Lexapro or escitalopram, 10 milligrams every single day, once a day. I take it before bed so that it just is in my system for the next day. It keeps me normal, sane, and anxiety-free all day long. And I can honestly say that being on escitalopram, I have felt so much better. The anxiety that I experience is very acute, very short-term, very temporary. Since being on the escitalopram, I haven't used Xanax at all. And in fact, I barely touched my Xanax since 2015, when it was really bad at the beginning of my anxiety, at the beginning of when I was diagnosed with general anxiety disorder, which is ultimately what my doctor diagnosed me with, to put me on a daily dose of an SSRI. So with that medication in my system, one of the number one expected side effects of the drug is weight gain. So that's something that I've been dealing with on the side that hasn't really been giving me anxiety, but it is an actual thing. I've gained like 20 pounds since I've been on this medication, and it's crazy, but I'm working right now to kind of get out of that. Putting that aside, really the main reason I'm making this video is about anxiety and why do we have it as nursing students? Why do nurses and nursing students acquire anxiety disorders, panic attacks, or depression? I really think it comes down to the intensely high stress level that is put on nurses and nursing students. So starting off as a nursing student, most programs are jam-packed with all this information. They're quick and accelerated, and I mean, they freak you out. Like, you really know from the beginning if you're meant to be a nurse or not. And having this anxiety still made me want to push through and be a nurse, and I still to this day want to be a nurse with like all of my heart. But it's so scary thinking about all the things that may or may not happen. But the point being is you just can't think about the bad things. You have to focus on the good things. So, without going on medication, I have some tips for you on how to lower your anxiety. But I highly stress that if you are experiencing panic attacks, anxiety attacks, depression, anything of the sort while you're in nursing school or as a beginning nurse or even later on as a nurse, you know, anxiety can come upon you at any moment in time. It's that scary. But if you're experiencing it, definitely go see your doctor. I do not want to be like the type of person to just say this is what's going to work for you, because I have no idea. Everyone is very different. So definitely go see your doctor. I am not a professional. I am just talking about my experience. Along with all of the medication that I'm prescribed, I also have techniques to help me lower my anxiety. And one of them being is I love taking bubble baths. I love getting some Lush products or some Bath & Body Works products and making myself a beautiful bubble bath. I love to write. Writing has always been an outlet for me. I love to vlog, which is an obvious thing here on YouTube. Letting out all my expressions that I need to on my vlogs is really therapeutic for me. Spending time with my family. In the past, it's really stressed me out because I'm thinking, oh, I gotta be studying and doing this and that, but you really need to take breaks and let your brain get away from information to really retain it in nursing school. So don't let all of that stress you out. Spend time with your loved ones and do the things that your heart is telling you to do. So I hope that those couple tips kind of helped you. They definitely helped me. I haven't found real relief in exercising. It kind of brings on anxiety for me in some situations. So I really find that I have to have my anxiety under control before I can go work out and do the gym. But exercise is another great outlet that you can definitely utilize when you're having anxiety. So I hope this video wasn't too rambly, but I just wanted to let you guys know that if you are experiencing anxiety in nursing school, that you are not alone. And I'm a prime example of someone who's very high strung, very anxiety ridden, and slightly medicated. So in case you were wondering, I just wanted to let you all know you're not alone. Here's Case, having multiple issues while in nursing school. It definitely has not been a smooth sailing ride for me by any means, but that's okay. I'm going to look back on this time of my life and just wonder how I got through it, and just be so proud of myself for getting through it. So that being said, thank you guys so much for watching this video. Leave a comment down below if you just want to talk or you have any questions. I'm there for you guys. As always, make sure to subscribe to my channel for more videos about nursing school like this from me, and I'll see you guys all on another time. Bye everyone. Don't stress out. Please don't stress out. One of my biggest essentials for clinical is my stethoscope, and I have a Littmann quality stethoscope. It's one of those big